Hi, my name is Shazmin, Shaz for short, and I am finally going to be uploading some videos on my /military journey /respiratory therapy journey. You're gonna have to excuse my hair. I had washed it. I just didn't feel like messing with it, so I just threw something on, whatever. I know, like a mess right now. But I wanted to today talk about my respiratory therapy journey. I am in my 3rd semester of respiratory, which we're learning about mechanical ventilation, pathology 2, and rehab and home care. And I can honestly say, like, I have been feeling discouraged since I started this program, but I'm still pushing and still trying to get there. I guess I was losing sight, like, at first, of why I really wanted to do this, and I have like all the reason, to want to do this. My kids, they all suffer from asthma, and my father, he suffered from COPD as well as congestive heart failure. He's now deceased, but I always knew from a young age that I was going to do something medical. I just didn't know exactly what it was going to be. I thought it was going to be nursing, but yeah, that didn't pan out. But that's another story for another time. But I'm gonna take you back a little bit. 1st semester, I I went in, thought, that, hey, maybe this won't be so bad, but yeah, I was on the struggle bus, like, for real. We all, all of my other classmates, we were struggling in cardiopulmonary anatomy. That is hard, okay? Like, I'm gonna front to you. When I got, my first test, I failed. And I'm just like, I had studied, did all of this, and this is what I get? Like, what? I'm like, okay, I need to switch up my study routine. Tried flashcards. That did not work for me. I tried rewriting my notes over. That did not work. Tried to retype my notes. That wasn't working. So truth be told, I was struggling, really bad with it. Like, pharmacology, it was hard, but it wasn't as bad as anatomy and cardio. It was not that bad. Fundamentals, it wasn't that bad for me, as well. That was just like the basics of everything like that, but it was rough. When I mean, this program is really designed to, it's either going to make you or weed you out. 2nd semester, it was hard too. I really struggled with pathology. Fundamentals 2 wasn't as bad. The second part of fundamentals wasn't as bad, but pathology, it was like anatomy all over again. I was like, oh my damn. I changed up my study routine, thought of a study group. Yeah, that shit did not work out. Excuse my French. I know kids are watching this. Yeah, that did not work out. So I had to find better ways, to basically know, what worked for me. I was doing a little, better toward the end. I had to end up making a 90 on that final, just to make it through to the 2nd semester, because path for me was bad. I'm talking about bad. Just now, getting ready to end 3rd semester in about 3 weeks, which is the summer. We only have we only have 10 weeks for the summer course, and that's when we have to learn mechanical ventilation. And I'm just gonna flat out tell you, okay, mechanical ventilation is hard, okay? You really have got to critically think. And I think for me, like what I struggle with, I have a hard time concentrating and like staying focused. Like I could be doing this right now and I just like get off subject, I get off topic, I want to jump to go do something else. You know what I'm saying? And that I'm still struggling with it, but like I said, I still keep pushing. I'm pushing, and I'm learning from it. Critiquing from it. Like when I get my exams back and I see and I'll go through what all I miss, and then I'll remember it, and I'll go back and read and remember just to study that harder next time. Mainly for me, what I'm struggling with now is, yeah, mechanical ventilation. It is hard. I have yet to make a 75 on 3 exams, and we only have 4 before the final. So yes, I see where I test and I'm just like, I'm hitting right there in the 60s, or like this exam today I made a 68. I was so close to making a 75, and I just like, I go back and I second guess myself like so much, you know what I mean? But pathology, I'm surprisingly doing pretty good in there. Pathology 2 is not that bad. Maybe because it's more smaller, more, you know, laid out in a platform that I can better understand it. And that's what I try to do to help me. You know, I know that's what helped me. I go to the library, I do, but like I said, I'm just the person that gets easily distracted, and I could be into it, I could be into studying and everything, and yeah. As soon as somebody walks in or somebody's like talking like really, really loud, and it's like, God damn, like I can't, I can't study now. So let me go and let me just switch up my effort. I couldn't really like focus at home, you know, like with kids, like with my kids and, you know, my significant other, because yeah, it's a long story. So I have to go places that are really, really quiet so I can just have that time to like focus, if that makes any sense. So like I said, I'm just gonna keep pushing because I only have 2 more semesters, and this is my thing. At one point I did want to give up. I just wanted to say like, forget it, why am I even doing this, like I feel stupid, this and that. But I had realized like I don't have to be an A student, you know what I'm saying, to like understand these things clinically, you know, how they work. C's, they get degrees just as well. Like, and I've steadily been making A's, B's, and, you know, C's mainly in pathology and like mechanical ventilation, like my averages or whatnot. And like clinically, like I understand. If you tell me I can go to that vent and I can show you this here, like what are you looking for, like what do you need, like what do you need me to do, but it's just like on paper, like I find it so hard to like understand, if that makes any sense. Like it is hard to understand it like mechanically on paper, just to be able to see it like in real life and how it works, being able to go in ICUs and see like what you're really looking at in real time, versus having to look at it on a book or like I said, paper. So yeah, I'm still, like I said, pushing. I do find myself sometimes still getting discouraged, but I remember, and I could tell you like for every, like since this semesters have been kicking in, especially from the first semester, I watch what was that guy's name? God, on YouTube, Big Money Bound. I watched his videos of that particular video. I believe I commented on it, and I told him, I said, look man, it is kicking my butt, but I will always remember what he said. He was like, remember, failing isn't failed, and if you really want something, you gotta do what you gotta do to get it. So, and that's, you know, and I just been like sticking by that, and it's really been keeping me going. Like for me to be able to pull like motivation, like I look at my kids, I'm like, damn, like I gotta do this. You know what I mean? Like they're looking up to me. Um, and I'm just not gonna sacrifice all my time and effort into all of this if I really didn't want it. So, like I said, it's been a little rough, and like I said, I have a lot going on outside of school, and it was even hard. Like 28, I graduated in 2010. You know what I mean? Like, yeah, I've been out of school a long time, and then trying to do it with 3 children. Then you have all 3 of them, which stay, sickly and that require more, care, having to get seen about. And yeah, and like the only really good support system I've been having is like my mom, bless her heart, she does so much for me and my kids. Like she watches them and stuff for me while I go to school Monday through Fridays, work whenever I need it, you know what I'm saying? Like she's there. And and that means a lot to me. I may not show it all the time, and I should, but it does mean a lot. And I just realized like I miss time with my kids, but I know like at the end, I'm just trying to make it to May 5th, my graduation date. I'm trying to stay positive and keep going. So that's why I made this video here today. Like it just doesn't apply just to, like respiratory. That's with anything, that you're going through or trying to go back to school and do. You can do it. You just have to, keep motivation while you're doing it. Don't lose sight. Don't get discouraged and just want to give up. Like don't give up. You got to keep pushing. And my instructors, they both told me that, despite what I was making like on my exams, and I just like I went to my clinical instruction. I'm just like, damn, like am I stupid? You know what I'm saying? Like what is going on? Like why can I not like retain the information? And this is what she said to me. This was, when was this? Second semester. No. Yeah, second semester, last semester. And we were getting ready to go for our Sims final. And I thought that I had failed that Sims final, and I just wanted to cry because I kept like stuttering my words. Like, anything about it, when you have to do like a clinical simulation in front of your instructor, like, yeah, you're gonna be nervous as hell, and I was. But I can remember going in there, and I was like so nervous. Like it was like she was telling me like what was gonna be on the sim, and I'm just like, oh my god, she can see me in this 2-way mirror, and I'm just like, oh my god, I fucked this goddamn sim up or whatnot. But at the end of the simulation, I thought I had failed. I put my head down. I'm just like, oh my god. And she spoke up. She's like, Shaz, come here a minute. So I came to a little 2-way mirror and everything. And she was like, I just want to, give you a compliment. Because at first I tried to cut her off because I thought for real, like I was getting ready to bawl like bad. But she told me, she was like, I really think you would make a dang good therapist. But I just literally had to concentrate and really be in my books and stay in my books. And that really like was surprising because I was surprised. I didn't, think that she thought that about me. And like I realized from that day on that I'm just like, well, I keep putting myself down. I don't give myself enough credit. You know what I mean? Never discredit yourself. I mean, I do a lot. And I may not be an A student. Sometimes you can be an A student and clinically, you don't know what the fuck you're doing. And I'm just going to be honest. So it's mainly about what you do for these patients and to take care of your patient. And I am glad that she's seen that in me because I didn't see it in myself. And it wasn't just her watching either. I had my other director of the program in there too. And she sent me a reminder. She was like, oh, I did great, I did great. And I thought I had messed it up. Like, literally, y'all, like, I was getting ready to cry. Like, I was getting ready to go in my car and cry all the way home because I thought, like, felt like this was it. You know what I'm saying? Like, because my thing is, if I would have gave up then I wouldn't have had, like, nothing else to fall back on. You know what I'm saying? Like, 28, come on now. I'm not going to want to go back to school and do all of that all over again, you know? So, I get emotional, like, I want to cry about it now, but yeah. I always keep that in my head. Like, my kids are the main reason why I want to do this. And my dad, you know, it taught me something. When he passed away, it really taught me that, man, life's too short. Because I thought I was going to have him a way lot longer than what was predicted. And it just hit me like a ton of bricks. Like, I was depressed, didn't want to eat, didn't want to talk. And he always told me, ever since I was a little girl, and I can remember, he was like, I don't know if you're going to be a doctor or something. He used to call me Nurse Shaz or Dr. Shaz. And he always said that I would do good in it. And ever since, like, he died, I just want to keep that promise to him. And I know now, if he was here, he would be so proud of me. That's just the type of, you know, person my dad was, you know. I try not to talk about it, get emotional, but that's all I'm, you know, wanting to say. Anybody that's feeling discouraged, you shouldn't. You just got to keep pushing yourself and you got to keep going. And remember what that guy on YouTube told me. Remember, failing does not mean you failed. You just got to keep pushing yourself. Like, give yourself, like, why do you really want to do this? And I have a legit reason why I really want to do this. So, yeah. Well, that's all for today. But this is why I just, you know, had to say this really quick. To anybody that, you know, like, feeling like they should just stop going to school or, you know, or drop out or anything like that, you shouldn't. You just got to keep pushing yourself, got to keep going, get that motivation in, you just keep running it up. So, well, I'm not going to keep y'all all night. Click the link and subscribe. And like I said, I'll post, like, I don't post like a lot now. Like, I'm just now starting up my channel and everything, trying to get it to grow and everything. So, but thank you so much. And yeah, I'll post something sooner or later. You know, I'll be busy. But all right, take care, y'all.